All right, well, we're going to go ahead and get started for in this informational session. So thanks to those of you who are here and interested. You probably know that we're going to record this so that it will be available to anybody, I think, on the college's website, Caleb. I'm not exactly sure how it's going to work, but instead of waiting till the end for questions, which you can ask, if you have any questions at all, just turn on your microphone and shout them out, and I'll see if I can answer them. If not, Caleb might be able to help us. If neither one of us have the answer, we'll definitely get back to you. So welcome this afternoon. Thanks for coming. My name is Dr. David Smith. I'm the program director of the Dental Hygiene program here at Kellogg Community College, and I hope that there is some interest in a dental career. It's a great career. There are lots of jobs available. We'll talk about that in just a couple minutes. Different jobs in dentistry: dentist, dental hygienist, dental assistant, dental technology, sales, marketing. But we're going to talk specifically about dental hygiene in the short time that we have together this afternoon. The nice thing about dental hygiene education is you're not in it alone. So in any program in dental hygiene that you run through in college, you'll be with the same group of students for the entire time that you are having your clinical training. Especially at Kellogg Community College, we have a small group. This year, we only took 10 students, so there's very good one-on-one teaching for our students. Usually we take 20, but because of the coronavirus pandemic, we've reduced the number of students so that we can see the proper number of patients in the clinic. So if you're interested in dental hygiene, you do have the opportunity to make lifetime friends. You will be spending a lot of time with your faculty and with your classmates during the time you're here. So if obviously you've been to the dentist, you've had your teeth cleaned, you've seen a dental hygienist, all of us. And so we generally think of a dental hygienist as just someone that cleans teeth. And if you have healthy teeth, a lot of times that's really all a hygienist will do for you. However, they have very broad scope of practice here in Michigan. There's a number of different things that makes the job of a dental hygienist very interesting. It is not always just cleaning teeth. So here's some of the job duties. On every patient that we see, we take medical and dental history. So we help patients understand the medications they're taking. We do complete examinations. Obviously, a lot of time is spent in dental hygiene, cleaning a patient's teeth and keeping their mouths healthy. We take and process X-rays, also known as radiographs. Here at Kellogg, we do it digitally. So we take an X-ray and it comes up automatically on our computer monitors. We can do nutritional counseling as dental hygienists in the state of Michigan. We can also give injections and nitrous oxide, which you probably have heard of. You probably call it laughing gas. So if a patient is nervous or it's uncomfortable for a cleaning, we can reduce a patient's anxiety and relax them by giving them nitrous oxide. We can take impressions for mouth guards. Last summer, we had the Harper Creek football team in. The entire team came in with their coaches. We took impressions and made mouth protectors for all of the varsity football players that kept them safe the entire season. As part of our examinations, we do oral cancer screenings on all of our patients. We'll talk about that. We do a lot of education in dentistry and dental hygiene. We do sealants, fluoride. There's a lot of record keeping in any type of healthcare profession right now. With safety in mind, that's very important right now during the pandemic. So we're taking extra steps to make sure that we are safe and our patients are safe. We treat periodontal or gum disease, and we take vital signs on every patient, including a blood pressure screening. And so occasionally we can help keep a patient healthy, even sometimes save a life by taking their vital signs. When we do examinations, we're not just looking at the teeth before we clean them. We are looking at a patient's face, their neck. We're checking their lymph nodes for infections, for potentially cancer. We obviously check teeth, but we're also checking inside the mouth, a patient's gums, their tongue, inside of their cheeks, the floor of their mouth, even way back in the throat, we're checking for potential throat infections. So we do a thorough examination of each one of our patients. It's not just checking teeth. But most of our time in dental hygiene is spent cleaning teeth. You'll learn all of the instruments, different ways to clean, the proper way that we sit, hold the instrument to make sure that we're safe for ourselves and for our patients. We take X-rays or radiographs on patients, and I'm sure, especially if you've had braces, if you've been in and had a regular checkup in a dental office, you have had X-rays taken. This is the type of X-ray I have up on the screen that gets most of the patient's face in the entire X-ray. So this is the eye here, here's the nose right here, and here's the upper jawbone and lower jawbone here. And then here's the teeth. This type of X-ray doesn't show the teeth very well, but we are checking for cancer, infection, the way that the teeth bite together in this type of X-ray. Here's actually the bones that, these are the bones of the vertebrae that make up our spinal column. And then up here, here are the bones that protect the brain. So we can see a lot on dental X-rays. How do we teach our students to take X-rays? We don't just have them go in and practice on patients. We have mannequins and models that we start with. So the students practice on mannequins and models. And here's an example of the mannequin that we use to train our students to take X-rays on. Inside this plastic mask here is a real human skull that was donated by somebody. And this skull has natural teeth, all of the bones, so that when we train our students, they're able to see what a real patient looks like. After the students get competent at taking X-rays on a mannequin or a model, then they practice on each other, classmates. And then once they are good at that, then they can treat patients in our clinic and take X-rays on our patients. If you've had braces, you've probably had an X-ray like this. This is the type of X-ray that goes all the way around you as you are standing in the X-ray machine. This, you can see the teeth much better. So here you can see the upper teeth, the lower jawbone, the upper jawbone, and you can see the nose here. If you've ever had braces, I am sure you had an X-ray like this. This is called a panoramic X-ray. And you can see that this patient has a lot of fillings. The bright white areas are fillings. And so you'll learn that kind of thing when you are being trained in our dental hygiene program. We can also take individual X-rays, and so smaller X-rays take X-rays of just 2 or 3 teeth at a time. And as you can see, these are much closer, and we can see the teeth a lot better on this type of X-ray. You can see this is a patient who is missing some teeth. So you see a space here between these teeth. So this patient has lost some teeth. Again, you can see the white areas, and these are fillings. And then you've probably had X-rays where we put something in your mouth and you have to bite down and smile. And these are the closest X-rays that we take on a patient. And here you can see really closely the teeth, the white fillings that they have. You can see the bone that holds the teeth in place. So we can look for cavities. We can check fillings. For instance, there's a dark area right here in between these teeth. This is what a cavity looks like on an X-ray. And this cavity is so small that this patient wouldn't have a toothache. They wouldn't feel it at all when they're brushing or flossing, but we can find them when they're really small and take care of them before they start hurting. These are called bite wing X-rays, and you've probably had these if you've had a regular checkup in your dental office. One thing that we do during our exam is we do a very thorough examination to check for cancer. It is a great service that we give our patients, and it only takes a couple minutes. Hopefully when you see your dentist, he or she, the dentist or the hygienist, does this where they check your gums, they check your tongue, they check inside your cheeks and beneath your lips. And this is actually a patient's tongue right here. And this white area is an early cancer. And patients don't really know what's normal in their mouth. And so one thing that we do in the dental hygiene program is we train our students to know what's normal so they can find abnormalities. This is a beginning cancer, and only a dental health professional would be able to find this. Most patients wouldn't know if this is normal for them. That's why it's important that students understand anatomy and what's normal, because this is another way that a dental hygienist could potentially save a patient's life by doing a thorough dental examination. Here is a cancer that has spread. This is a patient who is a heavy smoker. And obviously when it gets this big white area on the back of a patient's tongue, a patient might be able to see this in their own mouth. The long-term outlook on a bigger cancer like this is not so good for the patient. So that's why it's important that we all have regular dental and medical checkups. Our dental hygiene students are well trained to find these types of things. We do a lot of education in the dental hygiene program. We teach patients how to brush their teeth, how to floss properly, how to eat right for proper dental health and overall physical health. So we talk about this with our patients. So, I know I can't hear you guys or see you right now, but hopefully you're using a soft toothbrush. If you're not using a soft toothbrush, if you're using a medium or hard toothbrush, that can actually injure your teeth and gums. And we recommend a soft toothbrush and proper gentle brushing. In our dental clinic, we give our patients the type of toothbrush and tooth paste and floss that we recommend, and we give that to our patients for free, so that we're making sure that they're using the right toothbrush, toothpaste, and floss. So our students are trained on properly educating their patients. In Michigan, dental hygienists can give injections for any type of dental treatment, so when patients have dental treatment, it's comfortable. You see this little girl? If we give a nice, comfortable injection, and we learn to give comfortable injections in the program, it makes dental care much more pleasant for our patients. We have an entire class dedicated to giving comfortable, gentle injections. In the same class, students also learn to give nitrous oxide, what our patients call the laughing gas. You may have had laughing gas, maybe if you've had your wisdom teeth out, if you are nervous about seeing a dentist. The laughing gas or nitrous oxide relaxes our patients so that they can be comfortably treated in our dental clinic. So our students are well trained in giving injections and administering the laughing gas to put their patients at ease for their treatment. Again, if there's any questions, you can turn on your microphone and just shout it out. In Michigan, hygienists are able to do nutritional counseling. So we can talk about what's healthy and unhealthy, not just for healthy teeth and gums, but for overall health. In fact, there's an entire course on nutrition where students learn to talk to their patients about proper dietary habits. Now you can see this, I like this picture here, not real healthy, right? Instead of a bun, we have 2 grilled cheeses, 8 slices of cheddar, 4 fried eggs, 2 half-pound hamburger patties, 4 slices of bacon, some delicious tater tots here. But you can see it is a little healthy. You can see the healthy lettuce and tomato. So you have a little bit of salad there. So we would learn why this is not healthy for our patients. I guess once every couple months would be healthy, but if this is your dinner every other day, we're going to have to help our patients with their nutrition. Hygienists in Michigan can apply dental sealants. This type of treatment requires no anesthesia, no injection. We actually clean the tooth and then brush on a sealant. And you can see this picture on the left. Patients can get food and bacteria caught in deep pits and grooves in the teeth, and that's what causes cavities. So we just use a special cleaning solution on the tooth, and then we brush on this sort of like a plastic sealant material that protects the tooth so the food and bacteria can't get in and cause cavities. Some of you may have dental sealants, and it really reduces the chance that your patients will develop cavities. And so our students learn to do this, dental sealants. To be a good hygienist, to understand the anatomy so we can do a good examination and check for cancers and infection, to give comfortable injections, to make sure you're gently cleaning teeth, you have to have a good understanding of anatomy. So if you have had science classes in high school on maybe anatomy or physiology and you kind of enjoyed that, you would enjoy the dental hygiene program because we use our knowledge of anatomy for some of the things we've already talked about. So why do people choose to become dental hygienists? If you're not really sure what type of career, what type of college degree you might be interested in, what type of person might be good at being a dental hygienist? Dentistry and dental hygiene is a health profession, so we really can help a lot of people, give them a nice healthy smile, take them out of pain if they have disease, help them with their nutrition, make sure that their blood pressure and their medications are right. So if you want to help people every day in a profession, dental hygiene is a good profession. If you want flexible hours, a lot of dental offices have very flexible hours for hygiene. You may just want to work a couple days a week, especially if you're interested in a family. If maybe you just want to work in the morning or in the evening, there's flexible hours. If you want a career that focuses on your patient's health, again, this is a healthcare profession. And it's obviously we do clean teeth, but there's so much more involved. If you want to be able to educate patients, many of our graduates were kind of interested in teaching, but they didn't want to be in a classroom with 20, 30 students every day, the same students all year. If you're interested in educating people, dental hygiene is a great career for that because there's a lot of prevention involved, explaining to the patients how they can have healthier teeth, healthier gums, healthier lifestyle. If you want a challenging career, you get to use your hands, you get to use your scientific knowledge. So it continually helps you. You follow new science, and so it's a challenging career. If you're one of those people that like to meet different people every day, hygiene is great. You might see 5, 6, 10 patients every day. So every day you come into the office, you're meeting new people. And that is a positive in the profession of dentistry and dental hygiene. So if you work in an office, sometimes you might just work with 3 or 4 people, the same people every day. So dentistry, dental hygiene is a good way to come into work and every day have a unique, interesting experience. If you like to work with your hands, there's a lot of that. You're working with your instruments, you're taking x-rays, you're pouring up impressions where you're making models out of clay or out of plaster or stone. So you get to work with your hands. And again, like I mentioned, you can use your scientific knowledge to be the best hygienist you can be. So if you're one of those people who like working with your hands, but you've also enjoyed your science courses, dental hygiene might be a career that you might want to look further into. Well, I mentioned meeting new patients every day that you come in and you're never really sure what that patient is going to look like. So it's a very interesting field to get into. And yes, this is one of my former patients. If you're interested in dental hygiene, what are the educational requirements necessary? First of all, in Michigan, you need to graduate from an accredited dental hygiene program. Colleges in Michigan offer either a 4-year bachelor degree in dental hygiene or a 2-year associate degree. Dental hygiene is one of those few health professions that you can work for 2 years, get a 2-year degree, an associate degree, and then get out, get your license, and start working in your chosen field. You also, because you're touching patients, you have to take a number of board and certification exams to become licensed in the state of Michigan. Kellogg Community College has a very good track record in allowing our students and preparing them to pass these licensing exams. So if you're interested in dental hygiene, what should you be looking for? Number one, to be able to be licensed in the state, you need to have be in a program that's accredited by the American Dental Association's Commission on Dental Accreditation. You need to make sure that there are employment opportunities. And in the state of Michigan right now, all of our graduates from the class of 2020, they are working. Anybody who's wanted to work has been able to get a job. So there are a lot of employment opportunities in the state of Michigan. So you want an accredited program. You want to make sure that you visit the program and that the instructors have experience both in the clinic and the classroom. You want to ask the program, the director, the admissions experts of the program you're interested in, how do their graduates do? What are their pass rates on the national and regional board exams that are necessary for licensure? And you want to also visit the clinical facility and make sure that they are utilizing the latest technology and techniques. At Kellogg, we have made a lot of changes just to improve safety of our students, our patients, and our instructors because of the COVID-19 pandemic. And if you walked through our clinic, you can actually see those changes. We are continually updating our technology to make sure that we are training our students in the best possible way. So if you're interested in Kellogg Community College's dental hygiene program, it is a 2-year program. It's 5 semesters, 75 credits. Our graduates will earn an associate degree in applied science in dental hygiene. You'll be taking general education courses. You'll be taking medical science courses, and then you'll complete your degree in the dental hygiene program with dental hygiene courses. So Kellogg offers the 2-year associate degree in dental hygiene. Some of the courses that are general education courses include communications, English, psychology, and sociology. Our science courses include human anatomy and physiology, microbiology, and a basic chemistry course. Then the majority of our classes that we offer for our degree obviously would be in dental hygiene. We practice in pre-clinic first before we see patients. We have classes in medical emergencies, anatomy. We spend most of our time in the program in our clinic. We have a fully functioning dental hygiene clinic. Students have their own dental hygiene chair, their own patient schedule, their own instruments, and we see patients every day. We learn to take X-rays in our radiography course. We learn about dentistry in the community. In the dental materials course, we learn to take impressions, do sealants, pour up models, mix cements in a dental office. We have basic information like histology and oral pathology. I already mentioned nutrition. We learn about our patients' medications and pharmacology. We learn about disease in periodontics. And then students learn how to give gentle, comfortable injections. And they also learn to administer the laughing gas in the pain control course. So if you're interested in dental hygiene, you can be assured that there will be a job waiting for you when you graduate. Even though this data is a little older now, it's actually better, but the occupation of dental hygiene is expected to grow by 33% in the next couple years. And because of the pandemic, it's growing even at a faster rate. So that's a positive. If you get your degree here at Kellogg Community College in dental hygiene, there'll be a job waiting for you when you graduate. Do dental hygienists like what they do every day? The answer is yes. Here's a recent survey about healthcare jobs, and you can see that right at the top of the list is dentist, nurse practitioner, physician. You can see that dental hygienist is number 4 on this list. What I like about this list is to become a dentist or a physician, that could be 8 years or longer of education in the college education. So that's 8 years past high school. Dental hygiene, with Kellogg's degree, you can get done with high school, get a 2-year degree, and get your license and start practicing in dental hygiene. So if you're not interested in going to college for many years and you want a great career with good income potential, dental hygienist is something that you could consider. So how much does a dental hygienist make? The median hourly pay is right now just under $34 an hour, which equates to an annual salary of about $70,000 a year. And remember, this is with a 2-year degree. Right now, there are almost 200,000 jobs nationally in dental hygiene. So Kellogg Community College is fully accredited. What that means is if you get a degree through our program at Kellogg, you can apply for licensure, take the boards, and practice in any state in the United States. So you have a lot of options. You're not just, you don't just have the ability to practice in Michigan, you can practice in any of the 50 states. We're fully accredited. That's what that means. What about if you're interested in staying in the Calhoun County area? If you're interested in dental hygiene in Battle Creek and Kalamazoo, again, the salary ranges, these are annual salaries from $56,000 to $74,000 a year. It's a little bit higher if you want to move to the Detroit area, $59,000 to $78,000. And you can see Grand Rapids and Lansing, about the same, mid-50s to mid to upper 70s as an annual salary. And again, these are salaries for hygienists who are interested in full-time employment. We mentioned when we first met that many hygienists are just interested in working part-time because there's a lot of flexibility associated with the profession of dental hygiene. So that about is a good overview of the profession of dental hygiene, some of the courses that you would take if you are interested in our profession. I gave you some specifics about our excellent program here at Kellogg Community College right here in Battle Creek. Are there any questions that come to mind after the short time that we've had together this afternoon? If you are thinking about it, you're welcome to reach me here at Kellogg. All you would have to do is call our number and someone can get in touch with me. You can always call Caleb's office that you can ask for academic advising. You could ask for admissions. There's many knowledgeable individuals here on Kellogg's campus. If you have any questions at all about our profession, about coming to Kellogg for dental hygiene or any other degree, or if you have specific questions about dental hygiene. Caleb, do you have anything to add before we sign off this afternoon?
No, I don't think so. That really covers it really well. I guess the only things I can do, I can drop the main advising number in the chat. So if you do want to consider getting to this program, you can meet with me. We'll talk about the admission requirements, so things that you have to have done in order to be able to submit an application for the dental hygiene program. So while it is a 2-year degree, that's another thing. Very often students will actually spend 3 to 4 years at KCC, just getting all those gen eds and pre-science courses done out of the way before getting into the program, but that really can vary. It just depends. But we'd be able to look at the admission requirements and kind of make a plan for getting ready to apply to the program. So yeah, let me drop that number in the chat here. Does anyone have any questions for me?
All right. Do you have the number in the chat there, Caleb?
Almost.
All right. Let me know.
Perfect.
All right. Well, if there are no questions for me or Caleb, we appreciate your attention this afternoon. And I hope that this sort of got you interested in dental hygiene or something in the dental field if you're not sure. It's an incredible profession. You can really help a lot of people every day if you are in dentistry, dental hygiene specifically. And perhaps if you're interested, I will look forward to meeting you sometime on campus in one of the prerequisite courses or perhaps in the program. So if there are no questions, I guess we will end our session this afternoon. I appreciate that and enjoy the rest of your days.